Let's get more on this now with Tarik Jašarević, who's from the World Health Organization. Thank you very much indeed, Tarik, for joining us again. What are you hearing from your teams on the ground about the current situation in Gaza, both from the military fighting and now the extreme heat and lack of water?
Well, indeed, Paul, the situation for people of Gaza is not getting any better. It's just getting worse with continuous shelling attacks. We have seen attacks in previous days resulting in many injuries that should be treated in hospitals, but many of these hospitals are either not functional or they cannot provide services that are needed. On top of people who are injured and who need trauma intervention, there is an issue of people with chronic diseases who cannot access health services, like people with cancer, like pregnant women who cannot access prenatal care. And on top of that, as you say, there is a heat, there is a lack of clean water, there's a lack of sanitation, prompting the spread of infectious diseases, respiratory viruses, waterborne diseases, skin diseases. In one word, the situation for people of Gaza is horrible, and everyone is at some level of risk to their health at this point.
So, horrible injuries and chronic physical disease. What about the psychological impact of the repeated displacements and the constant threat of attack?
Well, this is something we will have to look at some point, and we know from previous conflicts that people who live in a protracted situation of stress, they are far more likely to develop one or several mental health conditions than people who are not exposed to such level of stress. Can you just imagine people who have been displaced multiple times, people who have lost members of their families, who are being bombarded on a daily basis, who don't have any way to live nowhere near any dignified life, who are crammed in overcrowded shelters, who don't have access to toilets, to shower. So obviously mental health, unfortunately, for people of Gaza will be a big issue for a long time to come.
And how difficult is it for aid groups to carry out their work in Gaza, and how much of a fear is there that there is going to be a wider escalation of the conflict, with potentially Iran retaliating for the killing of the Hamas leader? Could that make things even worse for Gaza?
Well, it's difficult to see how things can get any worse in Gaza, although many times we have said it can't get any worse, and then it got worse. We don't have that humanitarian space we need. Many of our requests to movement within Gaza, those requests are being denied. There are lengthy checkpoints that delay our attempts to reach hospitals. Sometimes Palestinian health workers are being detained at checkpoints. We cannot bring health supplies in because Rafah closing is closed. We can't evacuate patients who need to get treatment elsewhere. So we don't have that humanitarian space we need. Really, the only solution for people of Gaza is a ceasefire, to let the health workers go back to hospitals, try to rebuild some of the services and reopen some of the services. Unfortunately, we keep saying this now for months, and we still don't see the end to this nightmare for people of Gaza.
Tarik, we appreciate your time. Thank you for talking to us. That's Tarik Jašarević from the World Health Organization.
Thank you.